Great. Hi, everyone. Welcome to House Healthcare. It's Friday, May 5th. And this morning we are returning to 481. We had some questions yesterday about the language changes that the Senate put in, specifically around the eating disorder language. I believe we were all okay. We'll come back to this, but I believe we were all okay with some of the other language that they may change. So we have with us today Chris Allen, who is our Director of Suicide Prevention. Welcome, Chris. And I've asked him, I sent him an email last night with the language and asked him to come prepared to give us Department of Mental Health thoughts on this. So welcome, Chris.
Good morning. For the record, my name is Chris Allen, and I'm the Director of Suicide Prevention here for the Vermont Department of Mental Health. Nice to see everybody again. So I'll just start in really just have a couple of comments to make. One being the language relating to eating disorders and the model protocol and in the needs assessment. It's certainly an important topic to have a focus on, although I think that having a singular focus on it is really important rather than having it being wrapped into suicide prevention, as eating disorders requires specialized training and expertise and in order to treat it effectively. It's certainly a risk factor for suicide, and it's a really important one at that. In the working group on eating disorders report, it remarks that an average of 10% of those with eating disorders will eventually die from their disorder, and 26% will attempt suicide. So it's certainly really important to have a focus on. And I also think that it might be a natural outcome that could be included in model protocols or in a needs assessment. But I think that the original intention of House Bill 481 is on suicide prevention. So I would like it to kind of remain there, and maybe eating disorders, will be a natural outcome of discussions around model protocols and a needs assessment. But I think that's where I stand on it, where DMH stands on it.
Great. Thanks, Chris. I have one question, and then I'll open it up for everyone. The way it is added into the language, and actually, Daisy, this was, I think, one of the things you were talking about, so you might be able to explain it better. Do you feel the way it's written into the language, if we keep it in, that it is a part of everything you're looking at, or that it narrows the scope of the whole bill to this? Is that what your question was? Like, is this language, do you read it as this language is going to be focused more on eating disorders than the overall concept of what we were trying to put through, or intent, which was, suicide prevention, education, postvention?
I read it as more like prescriptive, that like it's a suicide prevention plan and it's also an eating disorder, like matched together. And so I think it would kind of dilute what would be in a suicide prevention specific plan. Does that help clarify?
It does. If it stays in,
yeah,
I would want to make sure that our intent is that we are doing a suicide prevention strategic plan, model protocol for the schools, and a model protocol on eating disorders. that model protocol for suicide prevention would still be the intent of this bill. Just want to make sure you read it that way, or that we are expressing that to you if this language stays in.
Yeah, that I could certainly come up with a model protocol for eating disorders, but I'm not an expert. I don't have any knowledge or expertise on eating disorders. It's a very specific skill set that that you would need in order to address that thoroughly.
All right.
Is the way that this is a question, I guess I'm not sure for who the question is the way the language written specifically directing Mr. Allen's role to accomplish the eating disorder part, or is it the agency's role?
Let me go back and look at the language passed.
Because I agree, if it's not within his scope of expertise.
It does say the director shall, it says the director shall.
Director in collaboration with AOE. Okay.
So AOE then could get involved.
Mm-hmm. Is AOE have the expertise? I'm sorry, I didn't.
Any other questions for Chris? Let's make this up.
I'm not sure this is an appropriate question, so you can say it's not. Sorry, Chris. We're at the end of the session and things are moving fast. Would you rather have this bill with the language, or if it didn't work through the system, not have the bill at all?
It's our bill. They didn't ask for this bill. Let's remember that.
No, but I'm just curious to know if he has an opinion, but maybe that's not appropriate. He's the.
So I think the question is more, would you do this work anyway if you didn't have a bill? Since it was your bill.
Well, we want the work done, but if this bill is killed, then you'll still do the work. Or I guess what I'm trying to understand, what happens if the bill doesn't happen, or is it better to have this not ideal?
I don't know, Chris, if that's something you can answer or not, and I completely understand if you cannot.
Yeah, totally.
It's a really good question, and I'm not so certain that I could answer that.
Thanks, Chris. That's fine.
Yeah.
I have to comment when Chris is done.
Okay. Anyone else have questions for Chris?
I just got to throw my opinion out. I believe this eating disorder is very, very important. There's a lot of other things in our school system that are very, very important. And I don't want this bill just to identify a certain category. There's bullying, there's racism, there's poverty, there's everything in this. And I just don't want it to seem like we're focusing on one issue. That's my problem with this.
Chris, thanks for being here today. I know you're busy. Can you tell us, like, in the swath of mental illnesses and disorders and challenges that people in Vermont have, where do eating disorders stand in terms of the increases that we're seeing in incidents, and also in the fatality rate or mortality rate? I know you mentioned that 25% of people end up attempting suicide, did you say? Can you give us some indication of the severity of this challenge that people have that might have led to this recommendation? I know there was a report and a lot of work done last biennium, and I think that was left out of our discussion yesterday, and I did some work last night to kind of review that report. And so I know these recommendations are actually coming from a lot of work that's been done by the agency and a lot of stakeholders. So, I really appreciate the work that was done there. And I just want to give us a chance to lift up the importance of the issue and why it might have been brought to the front of the line for priority. And if you can add any quick stats to the incidence of eating disorders and prevalence of it in Vermont. I know it's not your area of expertise. I heard you say that, but do you know in terms of suicide attempts, where that falls in regard to other mental health challenges that folks live with?
Yeah, I certainly know that it's an emerging. So this is also kind of where I see it could be fitting in with the strategic plan is in the original language, there's an ask to look at emerging research, and that might be where it falls in as well. Eating disorders, in my quick cursory glance at the report, it's primarily in young women 15 to 24, and that has placement in intensive outpatient and in other community-based programs is really the strong recommendation to address it, because there are no placements in Vermont for people with eating disorders. So they would be placed out of state. And my recollection is that it would be in Massachusetts.
Yeah.
And they've seen an increase in people from people in Vermont being referred to that placement, which is specialized in eating disorders exclusively.
Thanks, Chris. We have another question, Maureen.
It is a comment, but feel free to weigh in on the question of singling out one issue. I tend to disagree because we do that all the time here, and we write bill language all the time about specific issues within specific agencies or fields of work. And this is one that has been, I wouldn't say ignored, but has not had focus on it. And there are, as Chris said, there's a damaging lack of resources for people with eating disorders and their families, and it requires at some point in an individual's experience and progression with eating disorders, for example, anorexia nervosa, they will get so sick that they can die. They require feeding tubes and or intravenous feeding, and the individual does not want to have that and will fight really hard, like physically. It's so traumatic, and family members, parents have had to, because there's no place for this kind of treatment in Vermont, family members, parents have had to physically restrain their child to be able to get them nutrition, to keep them alive long enough to get the treatment that they need so that they will heal. So it is an issue that does need focus sooner rather than later. And I don't want to slow down the bill, and I'm not asking for Agency of Education to weigh in on this, but there are health professionals within school systems that AOE oversees that would have the expertise to just provide education. I'm not saying provide treatment. I'm not, nothing big, but at least to start to provide education.
Okay.
Thanks for that comment.
Anyone else? All right. Thank you, Chris, very much. We appreciate it. I think, go ahead. Sure, go ahead.
I just want to add one more quick note. I saw some language, and I don't know if this is still in there or not, but on a model protocol for healthcare facilities on suicide prevention.
Yes. Yes, that is new from the Senate.
And I apologize about the jets too. I live near the airport. And,
That's fine.
I'm wondering if that, healthcare facilities is a really large scope. And that would require more like personalized, unique protocols for each setting. And so I'm wondering if it would make more sense to focus on primary care settings initially, because we know nationally people who die by suicide are more likely to have visited their primary care a month prior to their death, as opposed to any other healthcare setting. So that is a real opportunity for us to focus on.
Okay. We will take that under consideration. Makes sense. Art, did you have a question?
No.
Okay. Okay, thank you, Chris, very much. We're going to be on the floor at 10, so I think we'll table this discussion and I would say, check email, depending on what time we're done with the floor. We'll either come 15 minutes after or we'll come after lunch, before 3.
Thanks, Chris.
Thanks, Chris.